Good evening, everyone. I'm Dr. Devlina, consultant neurologist. I'm working at Calcutta National Medical College, Kolkata. So, as a practitioner, regularly I'm faced with patients with epilepsy. And one of the most commonly asked questions by my female patients with epilepsy or their caregivers are, Doctor, will she be able to have a normal life? Will I be able to get her married? Can she have children? So today in this video, I will try to address a few of your concerns regarding these issues. Firstly, I would like to reiterate that epilepsy is not a contraindication to marriage, and it should never stop a woman from planning to start a family. However, as a woman with epilepsy, there are a few special things that you need to keep in mind. Number one, epilepsy is not a contraindication, but your seizures must be well controlled before you get married or start a family. So, in order to do that, the number of anti-epileptic medications in our arsenal right now are plenty. As time is passing, more and more drugs are becoming available to us. Surgical treatment is more amenable, more reachable to us. So, instead of hiding your illness and treating it as a taboo, please visit your neurologist and seek treatment, because it is a very easily controlled disease at present. So it is good to always visit your neurologist, not only when you are married or when you are planning to start a pregnancy, but I suggest visit a neurologist and make an wise and informed decision 1 to 2 years before you get married, so that there is adequate time to choose the appropriate anti-epileptic in the proper dose, so that you can easily prevent side effects, untoward challenges during pregnancy or childbirth, or even on the mother herself. Secondly comes the choice of contraceptives. It is always good to speak to your gynecologist as well as neurologist, because some of these anti-epileptic drugs, they have some interactions with the hormonal contraceptives. The efficacy of the hormonal contraceptives it gets reduced and can lead to some unwanted pregnancies. In such cases, it is good to speak to your neurologist or gynecologist and choose an additional method of contraception or switch to a non-hormonal agent. Then comes the fear of the most scary part of the anti-epileptic medications is congenital malformations, or the risk of having an abnormal fetus. Yeah, the risk in women with epilepsy is definitely more than the general population, but these are quite preventable to a large extent. If you help your neurologist by informing her right in the planning part, when you're planning to conceive, she will be able to change your anti-epileptic. She will be able to titrate the dose to an appropriate level, and if required, she can add an additional medication quite safely. So these are quite preventable, but it is good to be informed, and always inform your neurologist when you are planning a pregnancy. Apart from these fertility issues, in general, women with epilepsy face a few other problems. As you might be aware, throughout your menstrual cycle, your hormones go up, down, and there are changes throughout. And these might lead to some alterations in the seizure frequency or intensity in some parts of the cycle. If this is happening, again, they might not always be well treated with the conventional anti-epileptics. You might need some special hormonal therapy, and it is good to visit a neurologist if you are facing such a problem. I would like to conclude by saying that epilepsy is not a taboo, and it is very well treatable right now at present with advancing research every day. But as a patient, it is your duty to inform your neurologist and help her make the correct decisions, taking you along with her. So right from the planning of the marriage to getting married, taking a contraceptive, planning a pregnancy, during the pregnancy period, throughout childbirth, and even after it, visit your neurologist, keep her informed regarding your decisions so that she can make the correct decision for your well.